Hi everyone. Welcome to Cons Endo Bites, a channel to discover and learn. This is Dr. Vijeta, and in this video, I will explain about thermal tests in endodontic diagnosis. The contents of this video include the different types of thermal tests, the methods of carrying out the test, the different types of nerve fibers within the pulp, the indications and interpretation of results of these tests, and finally, their limitations. Before we plunge into the topic, it is important to understand three terms: sensibility, sensitivity, and vitality. Sensibility is the ability of any tissue to respond to a stimulus. This is because of presence of nerve fibers within the tissue. The pulp responds to stimulus like hot, cold, sour because of the presence of A delta and C nerve fibers within the pulpal tissue. Sensitivity is the condition of an exaggerated response to a stimulus. The term vitality indicates that the tissue has an adequate blood supply. Let us understand the different nerve fibers within the pulp. The two major nerve fibers within the pulp are the A delta nerve fibers and the C fibers. The A delta nerve fibers are myelinated. Because they are myelinated, they are fast conducting. They are the first to respond to a stimulus and they are sensitive to cold. The C fibers are non myelinated fibers and hence slow conducting. They respond late to the stimulus or respond last to the stimulus and they are sensitive to heat. Let us have a look at the indications for the thermal tests, which are pulp sensibility tests. The thermal tests are indicated prior to restorative, endodontic, orthodontic, periodontal, or surgical procedures to assess the status of the pulp. They help in locating and diagnosing a tooth with pulpitis. The pulp sensibility test can also help in differentiating between reversible and irreversible pulpitis. They can help in diagnosing a tooth that has a necrotic pulp. They can be used to follow up trauma cases and partial pulpotomy cases, and as a part to differential diagnostic process to exclude periapical lesions of pulp origin. Now let us have a look at the order of testing. Before testing the most suspicious tooth, we need to first test the disease-free contralateral tooth, followed by the opposing tooth, then the healthy tooth within the thermally painful quadrant before finally testing the most suspicious tooth. This helps in two things. It helps the dentist to give an understanding of the normal responses exhibited by the patient, and it also makes the patient more comfortable. The different methods of carrying out a cold test are eye sticks, ethyl chloride, dichlorofluoromethane or endo ice, 112 tetrafluoroethane or green endo ice, a mixture of gases, carbon dioxide snow, and cold water bath. The ethyl chloride spray is a general anesthetic and highly inflammable gas. It is no longer used because of the better options available today. The dichlorofluoromethane or endo ice has ozone depleting potential. Because of the environmental concerns, it is no longer available. The most common and simple way of doing a thermal heat cold test is with the use of a ice stick. The ice stick, the water can be frozen in anesthetic cartridges and they can be then used. The tooth to be tested is isolated and the ice stick is applied on the middle of the crown. The disadvantage with this method is that the ice can melt and the water can give a false positive response responding from the adjacent teeth. The next method of doing a cold test is with a carbon dioxide dry ice pencil. This requires a specialized apparatus in which the carbon dioxide dry eye pencil is formed. The pencil is extremely cold at minus 78 degrees Celsius. It has to be grasped in gauze and then applied on the tooth surface. The carbon dioxide snow is an extremely useful test. It can also be used on teeth with full coverage restorations like crowns. So, because of its extremely low temperature, it is expected to cause injury to the soft tissues. But generally, it is noticed that when carbon dioxide falls into the mouth, it does not harm the mucosa because of a layer of gaseous carbon dioxide that surrounds the frozen carbon dioxide. This is known as film boiling or Leidenfrost phenomenon. It was noticed by Ehrman in the year 1977. The other methods of cold testing include tetrafluoroethane or the green endo ice, which has a temperature of minus 26 degrees Celsius but reduces to minus 18.5 degrees Celsius in the mouth. Then this is a commercially available product from Colton Waldent as Endofrost, which is a mixture of propane, butane, and isobutane, which has a temperature of minus 50 degrees Celsius, reduces to minus 28 degrees Celsius in the mouth. These sprays can be sprayed onto a small cotton pellet, and the cotton pellet can be applied to the tooth surface to elicit a response. Coming to the methods of heat test. The different methods of heat test include Grossman's method using temporary stopping, heated ball burnisher, directing warm air with an electronic device like System B, dry polishing of the crown with a rubber cup, and warm water bath. The preferred temperature for a heat test is 65.5 degrees Celsius. The first method of testing is the Grossman's method using temporary stopping. The tooth to be tested must be isolated with cotton rolls and a thin layer of petroleum jelly is applied onto the crown. This prevents the temporary stopping from sticking to the tooth surface. The temporary stopping must be twirled in the flame until it becomes shiny or glossy and it should not slump. It is then applied onto the tooth surface to elicit a response. The next method is a heated ball burnisher. The ball burnisher is heated in a flame till it becomes red hot. However, the heated ball burnisher is not placed in contact with the tooth surface. Rather, it is held very close to the tooth to elicit a response. Another method of conducting a heat test is dry polishing of the crown with the rubber cup. Then we have another method of conducting the heat test, which is a warm water bath. The tooth to be tested should be isolated with a rubber dam, and a syringe is directed to spray the warm water onto the tooth surface. The advantage with this method is all the surfaces, that is, all the five surfaces of the particular tooth to be tested, are exposed to the temperature at the same time. So, what are the different responses to thermal tests? Whenever we note a response to thermal test, we should look at three things: the immediacy of the response, the intensity of the response, and also the duration of the response. There are different types of responses to thermal test. The first response is a no response. That is, absolutely there is no response from the patient, either of sensation or pain. This indicates that the tooth is non vital. The second response is a mild to moderate degree of awareness of slight pain that subsides within 1 to 2 seconds after the stimulus has been removed. This indicates a healthy state of the pulp. A normal pulp responds in this way. A third response is a strong momentary painful response that subsides within 1 to 2 seconds after the stimulus has been removed. Between these two responses, you can note that there is a difference in the degree of intensity. Here, only slight pain is felt, but here it is a strong painful response. However, the duration is the same. This type of response, that is the strong momentary painful response, indicates an inflamed pulp and it indicates a condition of reversible pulpitis. The final type of response is a moderate to strong painful response that lingers for several seconds or longer after the stimulus has been removed. Here you can note that the type of response is also more in intensity, that it is moderate to strong painful response, and the duration is also increased. It lingers for several seconds or sometimes minutes or sometimes even longer. This condition indicates irreversible state of inflammation of the pulp. Let us consider the limitations of thermal tests. The thermal tests measure only the pulp nerve responses and not pulp blood flow. The pulp blood flow is an actual indicator of pulp vitality. There is a lack of correlation between the responses of these tests with the histological status of the pulp. These tests are subjective, that is, they depend upon the patient's response, and hence they are inconclusive when used with children. They are also not effective in elderly patients and in teeth with extensive restorations, pulp recession, and excessive calcifications because of the limited amount of dentinal fluid available in these cases. The patients might respond differently to sensibility tests on different days and at different hours of the same day, that is, they lack reproducibility. They also have false negative responses. The false negative responses are seen in cases of excessive calcification, pulp recession, teeth with immature epices and recent trauma, and in cases of patient pre-medication. A false negative response means that though the pulp is vital, it is exhibiting a negative response to the thermal test. The key takeaways from this presentation are that thermal tests are sensibility tests. Each method of pulp testing, that is heat or cold, has its place and they are often complementary. The selection of cold or heat test should be based on the patient's chief complaint. And the thermal tests are important diagnostic aids. However, their results must be interpreted in conjunction with consideration of a detailed history, the symptoms, the clinical findings, and radiographic observations. If you like this video, like, share, and subscribe to Cons Endo Bites. Thank you.